6:05 now on this Tuesday, and today there's a decision looming that will impact what kind of treatment you get at hospitals. Later this morning, the Prince George's County Council is voting on a bill that addresses nurse-patient ratios. Randy Ayala has been following this story for months. And Randy, even if this bill does pass, that doesn't mean that we could see a change right away, right?
Exactly, Allison. And that's because it's the state who has the authority to mandate these ratios. Right now, only 2 states have legislation like this. That's California and Massachusetts. But this bill is really the first step toward getting something like that in Maryland.
Today, the Prince George's County Council is taking up Council Resolution 13-2023, also known as the Nurse-Patient Ratios Bill. It calls for the state of Maryland to implement a standard when it comes to how many patients a nurse can care for at one time.
We're seeing some nurses, responsible for up to 20 to 25 patients at a time, which is just insane. So we have to start looking at ways to make this job force easier for them.
The Board of Health would collect data on nurse-patient ratios at all healthcare facilities in Prince George's County, then submit its findings to the county. It comes as people living in Prince George's voice concerns about long wait times and lack of staff. DeBron Eubanks with the 1199 SEIU Labor Union says implementing this type of standard could save lives.
With this resolution, we understand that there will be lower patient mortality. We'll have fewer adverse patient events, such as, hospital-acquired pneumonia, respiratory failure.
Well, Eubanks also said nurse burnout is something impacting the industry across the country and including Prince George's County as well. Local nurses and union workers are gathering today at 10 a.m. outside the County Council building to advocate in support of this bill. The council will hold their final vote on this during their session that starts at 11 o'clock this morning. If it passes, it heads to the county executive's desk for her signature. Allison.
All right, Randy, we know nurses are so important. Thank you so much for that report.